So I'm on week 2 of my rotation here in West Virginia on my emergency medicine rotation. I'm actually working a lot of shifts this week. I have 5 shifts. Typically you'll have 3 to 4 shifts a week, but the reason I have so many is because I'm trying to finish the rotation a little bit early so I can get back to Atlanta on time. But I do have today off, so I decided to come over to the coffee shop this morning, and now I am headed back to the apartment. I do have my first interview next week. I'm going to use this week to run through some interview questions, go over my application, do some more research in the program, and yeah, fully get prepared for it. So as you can see from the title of the video, today I'm going to be talking about tips for 3rd year and really how to navigate 3rd year, some resources that you can use in 3rd year, and just tips for success throughout your 3rd year. So the way medical schools in the US are set up is 4 years. Your first 2 years are your preclinical years. So those are spent primarily in the classroom setting, learning the basic sciences. And then your 3rd and 4th year are your clinical years, where you're now in the hospital, you're taking care of patients, and you're working with the team. So the transition from your 2nd year tenure to your 3rd year can be a pretty big one, because for a lot of people this may be your first time, you know, interacting with patients or caring for patients. And so it's really important to know what to expect going in. So I put up a poll and asked a question on my Insta story yesterday about some questions that you may have about 3rd year. And so I have a list of those questions, so I'm going to get to those at the end of this video. So pretty much to start off, what is the structure of 3rd year and what are your rotations? So for every medical school, there is 6 core rotations that you have to take, and then outside of that, there is some variety of different electives that you take. But the core rotations that you take through 3rd year is internal medicine, pediatrics, family medicine, psychiatry, OBGYN, and surgery. Those are the 6 core rotations that you must take as a 3rd year student. Now, like I said, there is some variety. Some schools have a whole rotation dedicated to neurology or maybe some type of surgical subspecialty. Now, who is a part of the medical team? Generally, a medical team will consist of a 3rd year medical student, possibly a 4th year medical student depending on the rotation, an intern, which is a 1st year resident, an upper level resident, which is a 2nd or 3rd year resident, and then you have an attending. So that's the core team right there. Then of course you have you know, NPs, PAs, pharmacists, physical therapy, respiratory therapy. They make up the entirety of the team. But that main focus, the team that you're primarily going to be working with on a group basis, is going to be the medical students, the resident, and the attending. So now it's your first rotation of 3rd year. You may be wondering, what is the responsibility of a 3rd year medical student? This is going to be rotation and specialty dependent, but generally the medical student is responsible for gathering the history and physical, and generally just being as helpful as possible. And now, what does helpful mean? That is also going to be dependent on your resident and your attending. But let me get back to the history and physical gathering. So let's say for internal medicine, internal medicine admits new patients from the emergency department. So as a medical student, you're going to be the first one going down to the emergency department and getting that initial contact with the patient. So you're gathering the entire history. So what brought you to the emergency department today? What's your past medical history? What's your surgical history? What medications do you take on a daily basis? You know, what's your social history? Are you married? Do you have children? Do you do any drugs? Do you smoke tobacco? Do alcohol? Gather the full history and then do a physical exam. After that, now it's what's your assessment and plan? What do you think this patient has? Develop a plan for how to treat this patient. After you get that information, you then go back and you present to your team. So that kind of format with gathering the history and physical and presenting will be similar for like internal medicine, pediatrics, possibly family medicine just in an office setting, psychiatry as well. With surgery, you will be doing history and physicals, but in addition to that, you're going to be in the OR. So in the OR, you'll be doing things like assisting, maybe helping with closing, so you'll be doing sutures. So it's important to you know, really practice those skills prior to that rotation. You'll also be doing different things like, you know, retracting, which is an important job and is a tiring job, depending on how long the surgery lasts. Doing things like cutting sutures or maybe cutting skin. So pretty much just being as helpful as possible in the OR, but those expectations will be laid out to you prior to stepping foot in the OR. So that was just the general, you know, responsibility of a third-year student: gathering a good history and physical and being able to report your findings to your team so that they can then work together and develop a treatment plan for the patient. And so now the next thing is, walking into third year, what are some of the main resources that you're going to be using? This is going to be specialty dependent, but overall I would say the first thing to do is get the UpToDate app. This can be given through your university, and UpToDate pretty much has every single diagnosis on there. It has the workup on there, it has the treatment plan, and this is just a really good way to form your plan pretty much when you're presenting to your team. It's also a good way to, maybe before you head into a case, a surgical case, and you're gonna do maybe an abdominal repair, it follows through, it lets you see the different steps of that surgery. So just quick reads, and just handy to have on you. You can have it on your phone or you can look it up on the computer. Another resource is Online MedEd. These are videos, and it's broken down into different specialties. There's multiple videos per specialty, and it's a really good refresher, and it's really good when you're on the wards. Things like if you're getting pimped, pimped is just being asked questions. So the videos are really good to help you you know, work through different diseases, how to develop a plan, the next step in treatment, what kind of imaging to get. For example, they have a video on hyperkalemia. If you know a patient has hyperkalemia, what's the next step? And then it has a flow chart. The next step is you need to get an EKG. If there are changes, then what's the next thing you administer? You administer calcium, and then you administer insulin. So like, it's a nice flow chart, and I feel like that's always a great refresher going into a rotation. Maybe before you start a specific block, like, okay, let me go through all these videos so I'll come in with a fresh mind of what to expect. Then as you go through rotation, just split the videos up and, you know, watch all of them throughout the rotation. Okay, so we talked about the core rotations that you have, the responsibilities for a third-year student, two like general resources that you can use, which is UpToDate and Online MedEd. So now let's talk about how are you graded as a third-year medical student. Obviously this is going to be school dependent, but generally it is pretty similar. The frustrating part about third year is how subjective grading can be. So usually it's split up between a certain percentage is your clinical grade, and then another percentage is how you perform on your shelf exam, which is the exam that you have to take at the end of the rotation. So clinical performance, honestly, sometimes can be how well did your resident or attending get along with you and like you, you know? But a big part of your clinical grade is how well you present, you know, present your patient. So you can have all the medical knowledge in the world, but if you're fumbling through your presentation, you don't have a clear structure and format, it can make you look like you don't know what you're talking about, even if you do have that medical knowledge. So it's important that you're presenting in the proper way. Because honestly, you know, during rounds when you're presenting however many patients you have, that's can be the only interaction that you're having with your attending. So that's the only impression they're getting from you. So you have to be able to present well. I feel like with the residents, you get more of that one-on-one interaction so they can see all the different tasks you're doing or how helpful you're being. But with the attending, sometimes they're just in and out during rounds and that's it. So you have to make that great impression you know, during your presentation. So that includes getting a good and thorough history. One mnemonic that you can use for your history is old carts. So if a patient comes in saying that they have chest pain, old carts is a mnemonic to pretty much work through that chest pain. So I come in, I say I have chest pain. The O is for onset. When did it begin? Location, where is that chest pain? Is it substernal? D is duration. How long has this chest pain lasted? C is I believe the character of it. So is it sharp? Is it stabbing? Does it feel like a pressure or a squeezing feeling? A is associated symptoms. Is this chest pain associated with any nausea, vomiting, diaphoresis, shortness of breath? And A can also be aggravating factors. So does anything make it worse? Does anything make the chest pain worse? Are any relieving factors? Does anything make the chest pain better? And then T is the timing. When do you notice the chest pain? Did it wake you up from sleep? Does it happen when you're exercising? And then S is the severity. On a scale of 1 to 10, how would you rate your chest pain? And so really following that old cards mnemonic can really help you through a lot of the history part of your H&P. And as a medical student, you can really spend the most time with the patient because you have the most time. You know, the resident is busy, the attending is busy, so you can spend that time really hashing out the details of the story and getting a full history. You know, different details like, oh, you may have found out that this patient took some drugs, so maybe that's the reason that they're having this chest pain. You know, that actually happened to me on one of my EM rotations. A patient came in with chest pain. A little bit later, I went to talk to him, and he admitted that you know, he did take some cocaine, which obviously can contribute to chest pain. So little things like that, being able to go back, gather more history, do a proper physical exam, and then after you get your history and physical, it doesn't stop there. Now you need to come up with a proper plan. You know, your second year is really when you learn how to take a history and physical. The third year, you now need to learn how to assess and make a proper treatment plan. And it's not even about being right, it's just about having something there to say, okay, this is a plan, this is what I want to do moving forward. And this is where your resident can become your best friend. Before you get to rounds and you're presenting in front of everybody and presenting to the attending, you should be able to have some one-on-one time with your resident to go over the plan that that you want to commit to. So your resident can really help you hash out some details, come up with a proper plan, and really give you good feedback before it's time for you to present. Now, when your patient has a certain condition, as the third year student, make sure you know all the details about that condition. This is important during rounds because you are going to be pimped by your attending or possibly your resident on rounds. So if your patient has sickle cell, make sure you know the details about sickle cell. And this is where UpToDate comes in handy. Before rounds, you know, look up on UpToDate some of the key features of sickle cell, some of the treatments for it, different key facts about sickle cell, because it's highly likely that your attending is going to be asking you questions about the disease process. And if you're prepared and you're able to, you know, answer those questions with confidence, obviously it's going to look really good to your attending, and that'll be good for you for your evaluation. Now, I mentioned being helpful several times, and you're probably wondering, as a third year student, how truly helpful, you know, can I be to the team? What can I contribute? And this is why it's important to ask your resident and the attending, what is the expectations for me as a student on this rotation? And so here are some examples of how you can be helpful. You know, calling the lab to get updates. Let's say, for example, a lab hasn't resulted. You can call the lab and ask for the team, when are these results going to be uploaded? Things like maybe if a patient came from an outside facility, calling that facility and getting the medical records faxed over to the hospital. Certain things like that are being helpful. Let's say a patient needs to be discharged, and the only thing that's stopping them from being discharged is getting physical therapy to sign off on them. Call physical therapy, get an update, and see when they're gonna be able to see the patient. Those are the things that contribute and help the team move forward. Some other ways that are being helpful is to, you know, set up discharge appointments for your patient. Calling maybe CT or X-ray and asking when your patient can come down to get the imaging that they need. So these are several ways you can be proactive, get patient care moving, and just be overall helpful and a contribution to your team. So one part about third year is kind of feeling, I guess you would say, useless, or feeling like, why am I here? There's just a lot of downtime, a lot of time wasted. And that is true. Sometimes they just keep you around when possibly they could have dismissed you a few hours earlier. But when they do that, it's important to use that time wisely. So if you realize you're just sitting around doing nothing, pull out some UWorld questions, knock out 10 questions right there, or maybe pull out some notes, maybe watch some online meta videos. So there is gonna be a lot of downtime. It's gonna seem like there's just a lot of free time sitting around in the hospital. Make sure you use that time wisely, because it will add up. Let's say you end up doing 10 questions every day at the hospital. That knocks out some of the questions you have to do when you get home at the end of a long day. One other thing I will say is you know, don't shy away from picking up a difficult patient. You know, if you know you're not good at neurology and you have just admitted a patient has been admitted to the team that has a neurology issue, volunteer to pick that patient up, because by seeing that patient, by taking ownership, it just helps you improve. And one thing that I noticed is that by seeing different pathologies, it helped me with my UWorld questions. Hands-on experience really goes a long way. You know, a question pops up and you're like, you know, I treated this patient before, I know the workup for this, I know the symptoms, I know how to get the diagnosis, I know the treatment. Seeing many patients really helps you on exam day. I think one thing about third year that's not done enough is reviewing of notes, whether that's submission notes, progress notes, discharge notes. We may write them, but they're not always reviewed simply because of timing and how busy the attending or resident may be. But definitely don't sleep on how important note writing is, writing a full history and physical, because at the end of third year, you take step 2 CS. That's your clinical skills exam, and for each patient encounter that you see, you have to write a full note on it. So it's important to just develop those skills throughout third year. Each patient you see, make sure you write a proper note on it. Every once in a while, let your resident or your attending review the note, because that's really the only way that you're going to improve. Also with the physical exam, take time when you're with that patient to truly listen in for specific things. If you're not good with the pulmonary exam, take time with the patient that maybe have CHF to listen for the crackles, or the patient with COPD to listen to the wheezing that they may have. Like, really take time to find those subtle things on physical exam, really develop those skills throughout third year. So before I move into the last part of the video, which I know a lot of you are probably have the most questions about, which is how to prepare for the shelf exam for each rotation, I just want to go through the list of everything that I discussed so far. So the first thing was just the structure of third year and your 6 core rotations. And then after that is your responsibility as a medical student, which is really getting the history and physical and being as helpful as possible. And I talked about the different things and the different ways you can be helpful, and it definitely asks for the expectations from the team when you join a new team. Then after that, know how you're graded, you know, the clinical grade as well as the shelf exam, which I'm going to talk about later. And then also know who your evaluators are. You know, is the resident the one evaluating you, or the attending evaluating you? If you're jumping to a new team every 2 weeks, who is really going to be evaluating you? It's important to know that. Also, when you develop your plan, go over it with your resident. You know, get good feedback then, and be prepared for rounds. Be able to give a good presentation, be able to know every single detail about, you know, your patient, about the disease process, because you're going to be asked questions about those things. And then also, don't be afraid to pick up a difficult patient. In the end, it's just going to help you learn more. That's one more thing that's added to your basket, which is going to help your medical knowledge grow. It's going to help you on exam day as well, because you've seen those things in person. And then also, you know, use your downtime wisely. There is going to be a lot of downtime where it feels like time is wasted, but you can use that time to maybe look over notes or knock out some UWorld questions. And then get involved. You know, if there's an IV to be placed, if there's blood to be drawn, if there's a Foley to be placed, or NG2 to be placed, you know, volunteer to do it and really learn those clinical skills. Now, I think this video has gotten pretty long, but now the shelf exam. At the end of each rotation, you take a shelf exam, and this is a big part of your overall grade for that rotation. And oftentimes you have to get a certain score to end up with an A or an honors for that rotation. So the shelf exam is very important, and the preparation for it is very important. You know, you should start with day 1, just mapping out a schedule of how you're going to be preparing for the shelf exam. And it's really dependent on how long your rotation is. There's some 12-week rotations, there's some 8-week rotations, which is kind of average, and then there's also some shorter ones that can be either 6 or 4-week rotations. Now, I made videos all throughout third year, and within those videos, in the description box, you'll find the resources that I use specifically for that rotation. And so you can go back to some of my third year vlogs. I have a playlist called third year med school vlogs, and look at some of the videos and then just see some of the resources that I use. But your primary resource is always going to be UWorld. From the beginning of third year to the end of third year, you should make 1 full pass of UWorld. While you're in a certain rotation, do questions specific to that rotation. So if I'm in surgery, I'm doing strictly surgery questions. Also, there can be a mix of internal medicine questions in the surgery rotation because internal is kind of heavy in surgery. If I'm on my pediatrics rotation, I'm doing strictly pediatric UWorld questions. Now, as far as outside resources specific to rotations, again, you know, you can go back to my videos to see that, but I'll just briefly go through some of them. For internal medicine, you can use Step Up to Medicine, UWorld, and then Online Med Ed. For pediatrics, I would say UWorld, and then I would say BRS Pediatrics. For surgery, I would say Virgilio textbook, as well as Pastana. It's a small textbook, UWorld, Online Med Ed. For OBGYN, for me, I love First Aid for OBGYN. Quick read, really good. And then, of course, UWorld, Online Med Ed. Psychiatry, First Aid for Psychiatry is really great. And then UWorld and Online Med Ed. But as you can see, UWorld, Online Med are your primary sources, and you can always pick up different sources for each rotation. I think this video is pretty long, but I hope that kind of gives you insight into third year, gives you some good tips about how to navigate and how to be successful. And as always, if you have any more questions regarding third year, leave it in the comment section below. Make sure to check out my playlist with the third year med school vlogs. Some of those may be on private right now just because I'm in the application season, but in a few months they will not be on private. If you enjoyed this video, make sure you give it a thumbs up, make sure to subscribe, and I'll see you in the next one. Bye guys.